Hello, my name is Mairead and I'm studying in Mayo, Castlebar, GMIT, and I'm studying nursing. It's a 4-year course, Bachelor of Science, honours degree. It entails clinical placement and it contains theory as well. And you have a certain stint out in the wards where you learn hands-on about nursing and looking after people, and you learn theoretically then about the psychology behind people's manners and the mechanics behind nursing and the medicines and everything. And the reason why I chose the course is because it gives you endless options of travel. It's a steady job, a good job. It teaches you a lot about life. My own mother was a nurse. I didn't do it for that reason, but it's just a good job, and I really am thoroughly enjoying it in Mayo. I have studied there for the last 3 years. The lectures in Mayo Mayo campus are a great advantage to us. They're very helpful and approachable. The class sizes are very small, therefore we have one-on-one time with our lecturers. Whereas if you were in a bigger institute, you'd be seen as a number, not a name. Everyone knows everyone's name in Castlebar. It's great. Everyone's very friendly, and I would recommend it to absolutely anyone who is filling out a CAO form or has any mind of doing nursing. It's a great job, and you can travel anywhere in the world and have good life experiences with it. In the vocational school, I really didn't know what I wanted to do, and then when I saw this course in Castlebar nursing, I really jumped at the chance because of the amount of practical work that was involved and the hands-on work that was involved. I'm not a one to sit down and read through loads of books. It wouldn't be my cup of tea, but the way the course is divided up really helps me, and I really love my course. In first year, as a nursing student, you go into college and you're greeted by all your lecturers from the different modules that you'll be carrying out, which are clinical placement, which would be practical stuff which you need to know before going on to your first placement in the hospital. So you have a 6-week stint of study before you go onto the wards as a nursing student. You'll get your uniforms before you go on placement. You learn how to take blood pressure. You learn a very high blood pressure. You learn about low blood pressures. You learn very basic things in first year that will carry you through your whole career. You learn about heart disease, about diabetes, about basic things that you cover in your leaving cert year in biology. And you will see this on the wards with patients, real life patients with these conditions, which makes it very real, and it's just not being read out of a book. It makes it very real for you, the student. You'll have a 9-week placement in your first year before Christmas. Then after Christmas you'll have another 6-week stint. Your first placement will be medical or surgical. So if you have the medical before Christmas, you'll have the surgical placement after Christmas. Surgical placement entails hip replacements, knee replacements, people with broken arms, everything. You'll learn how to care for a patient before they go down for their operation, which is called pre-op, and after they come back from their operation, which is called post-op. So that is very important in your nursing care. You learn how to care for a patient and be empathetic towards them, and you're given all the bases of this in your 6 weeks in college before you go out, and before again you go out on your second placement, and all the time you're learning more and more, and you learn how to ethically and be professional and all those very important things as a nurse. In second year then it's more, you've got a feel for nursing, and you've got an all-round basis of what happens on a day-to-day ward round. Second year you have 3 weeks in college, and then you have a 22-week stint out on different placements. You rotate onto a different specialty every 3 weeks, which means you will be in A&E, you'll be in theatre, you'll be in paediatrics, you'll be doing all your specialties. So this gives you a taste for what you'd like to specialise in after you've qualified, after your internship. Third year you do, you have a bit more college because we have to get a degree, and we have to learn more about medications. So medication management is a big thing in fourth year, in pharmacology, or in third year pharmacology. You do a literature review, and you also have a 12-week placement, one before Christmas and one after Christmas. The same as first year, but you've more responsibility on the wards. You have a medical and a surgical placement, and you also do a week in ICU. So we had our ICU placement last week, so we're just back from placement, and we have an 8-week stint of college theory to our exams in May. Then in fourth year, you have a 3-week placement, and you have a 2-month stint in college, and then you have your finals in December. So I'm nearly there, but all nursing students will go out in their internship, which you get paid for in fourth year, and you do an 18-week stints. So it's a 36 weeks placement, and you get paid. You have your own bay of patients. You are basically a nurse. When you've reached your internship, you're a nurse, and overnight you change from your student uniform to your white uniform. So the big responsibility is on your shoulders, but you'll all be well able for it. And it happens pretty quick, but it's great experience, and you really will have enough of experience on the wards and both in theory by the end of your 4 years.